Hi, this is Dr. BAPUJI, Chairman of Center for Integrated Medicine, practicing allopathy, naturopathy, yoga, an integrated approach for all diseases, chronic diseases. Today, Times of India on page number 3, that is 10th April 2022, Sunday edition, main paper. They have given a very important news item. CCMB has conducted a research and it has come out with a report saying that statins means medicines which are used for reducing cholesterol. They can bring in structural changes in the cell. If you read it in detail, you will understand. I had been telling to my patients 3 years ago, Institute of Medicine, which is highest body in United States, situated in Washington DC, which decides the policy matters for medical field and procedures and all those details. It is the highest academic body. It has come out with the circular to all the medical establishments that statins have got more side effects than benefits. What are the side effects? One, liver gets damaged. Now what happens to those people who have got liver problem, those who are alcoholics, who take alcohol regularly? Similarly, it increases cholesterol and it also causes muscular pains, which cannot be accounted clinically. You cannot decide that it is a particular disease. So what happens is, in modern medicine, we have got the habit of giving a name. So we diagnose it as polymyositis. I have been seeing prescriptions of various specialists. Polymyositis means muscles, all our skeletal muscles. So you can have pain in the thighs, pain in the calf muscles, pain in the arms, pain in the back. And to investigate polymyositis, which is an autoimmune disease, CPK levels, LDH levels, so all these things, elaborate investigations are done. Now what is the solution? You have to go for painkillers. One is statins has introduced muscular pains. Now to counter that, you have to take painkillers. If you take painkillers, you will develop heartburn, acidity, then kidney can get damaged, liver can get damaged, double-edged knife. Statins are causing liver damage, painkillers also can cause. Now how many tablets can cause kidney damage, liver damage? We don't know. We can tell you only after it gets damaged. So what I am trying to say is, statins have got tremendous side effects. Apart from liver damage, I mentioned muscular pains, that is polymyositis, and it also increases sugar levels. And diabetics, he is taking insulin, he is taking number of medicines, but sugar is not coming down. And dosage of all medicines increase. Very difficult to manage sugar from outside. It fluctuates. That is one. Another important thing is, cholesterol is raw material for some of the adrenal hormones. There is an adrenal gland, small glands at the top of the kidneys on either side. They secrete very important hormones which maintains our salt and water intake, electrolyte balance, and then urination, cutting down urination when the BP is falling. All these things are controlled by adrenal gland. And adrenal gland also secretes a particular hormone which is necessary for fright and flight, you must have heard. So when you face a danger, you suddenly become very conscious, hair stands, pulse goes up, heart rate goes up, sweating occurs. This is a defensive mechanism. So that hormone cortisol, we call it, is also secreted from adrenal glands. Apart from this, testes also secrete sex hormones. Now cholesterol is a good raw material. So these are the important functions of cholesterol. Then why take statins, suppress it, then create new problems, go for new problems, and then some more medicines are added. The list goes on. 10 to 12 or 15 tablets patient takes by the time he comes for consultation to me. People do not know that we are seeing cases from head to toe, and we are thorough with the basics of all specialties. So cutting down medicines, one has to be knowledgeable. And patients are also happy when the list goes up. And it's a psychology of the patient. And some of the medicine should not be available. He has mobilized all his resources to procure the medicine. And when he travels, if that medicine is not available, what will he do? So these are the problems. Remember, statins should not be taken. I cannot mention market names here. The companies will object. Statins means cholesterol reducing medicines should not be taken. They have got serious side effects. And those side effects people do not know, including specialists and doctors do not know that it is the statin that is causing the symptoms. And that is separately investigated. And a patient, like a quicksand, gets into the medical treatment and ultimately succumbs due to what? Nobody can make out. Because number of medicines, which medicine has caused complication, we do not know. In ICU patients, when he dies, doctors cannot make out whether the number of medicines have caused the death or his organs have naturally deteriorated or multi-system failure, they say ultimately, when somebody dies. They cannot pinpoint. Only post-mortem can fix the diagnosis as far as cause of death is concerned. So my sincere advice is, please forget about cholesterol reducing medicines. Cholesterol is a very important component for our bodily functions and maintenance of cells, maintenance of insulation of the nerves, maintenance of electrolyte balance, maintenance of sex hormones. So people have got fear because it has been induced by modern medicine for the past 25 years, and some of the companies have made billions of dollars by selling statins. So please discontinue statins. Now people are scared. No, nothing happens. I had a patient 2 days ago. She has been put on statins. She has been put on rheumatoid arthritis medication in spite of being anti-CCP test being negative. So I don't know whether doctors are ignorant or it is deliberate. If it is deliberate, it is absolutely unethical in my opinion. So forget about cholesterol medicine. Please stop.